Well, hey everybody, this is Robert and welcome to today's show. Now, while Dr. Anthony Fauci has been literally all over the map since the COVID-19 pandemic started, from the use of masks to lockdowns and everything in between, my opinion is he is one of the biggest purveyors of confusion for the public. Despite this, he has received heaps of praise from the beginning. He's an icon now. And there's a great marketing situation going on with Fauci items, and everything from T-shirts to bobbleheads and every trinket in between. Now they're even going to start doing a documentary on him. And here's a couple of quotes from the directors of the film. They say, "There is only one Dr. Fauci, and it is an incredible privilege to bring his inspiring lifelong quest to cure disease and to prevent outbreaks to viewers around the world." They go on to say, "This film will be an unprecedented, intimate portrait of our nation's greatest public servant, whose relentless pursuit of truth and devotion to science has never been more important." Well, for me, I have to say, unfortunately, one of, if not the greatest figure in infectious diseases is no longer with us. And I really wish he was. And I'm talking about the eradicator of smallpox, Dr. D.A. Henderson. Now, fortunately, his words are still with us. And the idea of many of these mitigation efforts used in this pandemic actually came to light in 2006. Things like lockdowns and all this other stuff wasn't really talk or used prior to this COVID pandemic. But what happened in 2006? Well, there is an article from the American Institute for Economic Research which said, in 2006, at the order of the Bush administration, some computer science programmers with a small group of public health officials began to resurrect a pre-modern idea of quarantines, closures, and measured lockdowns. Now, this way of thinking is not just pre-modern. It turned on the logic of modern medicine on its head. It was based on a theory that we should just run away from the viruses. Whereas Dr. Henderson, he spent his whole life devoted to implementing the great discovery of modern virus theory, that we need not flee, but rather build immunity through science, either natural immunities or via vaccines. Well, when this report came out in 2006 that the Bush administration jumped on, D.A. Henderson, at the ripe old age of 78, and a team from Johns Hopkins responded to the ideas of quarantine and closures and measured lockdowns in an article entitled Disease Mitigation Measures in the Control of Pandemic Influenza. These papers, all before 2020, concerning pandemics, were all surrounded on the topic of influenza, because we didn't know of COVID, but the theory and everything remains the same. Well, the authors write of this D.A. Henderson article, a number of mitigation measures that are now being considered could have a serious impact on the ability of the health system to deliver adequate care and could have potentially adverse consequences for the provision of essential services. Many could result in significant disruption of the social functioning of communities and result in possibly serious economic problems. Such negative consequences might be worth chancing if there was compelling evidence or a reason to believe they would seriously diminish the consequences or spread of the pandemic. However, they say, few analyses have been produced that weigh the hoped-for efficacy of such measures against the potential impacts of a large-scale or long-term implementation of these measures. And I want to just go over some of the things they kind of talked about in... They talked about these things in more detail, but I'm just going to give you a quick synopsis. And of course, they say vaccination is by far the most important preventive measure. Concerning the provision of isolation and medical care for patients, they say special arrangements are needed for the expansion of surge capacity in hospitals. Concerning a communication strategy and plans, Henderson and his team write, open and frequent communications with the public are essential. This involves regular press conferences, hotlines, and provision of information through civic leaders, churches, schools, and businesses. An important message to request that all who are ill remain isolated at home or in the hospital, but to encourage others to continue to come to work so that essential services can be sustained. Concerning another hot topic right now, the closure of schools, they write, it has been the practice in many communities to close the schools for 10 to 14 days at the beginning of an epidemic of seasonal flu, primarily because of the number of both teachers and pupils who are absent. This is a reasonable initiative, they write, often expected in many communities, that also serves to demonstrate action on the part of officials. Closing schools for longer periods in hopes of mitigating the epidemic by decreasing contacts among students is not warranted unless all other likely points of assembly are closed. So they say malls and fast food restaurants and other types of recreation. Such widespread closures sustained throughout the pandemic would almost certainly have serious adverse social and economic effects. Henderson and his team were all on board with hand washing. Concerning canceling or postponing events with large numbers of people, they say that while local concerns may result in the closure of particular events for logical reasons, a policy directing community-wide closure of public events seems inadvisable. Concerning quarantine, they say, as experience shows, there is no basis for recommending quarantine either of groups or individuals. The problems in implementing such measures are formidable, and secondary effects of absenteeism and community disruption, as well as possible adverse consequences, such as a loss of public trust in government and stigmatization of quarantined people and groups, are likely to be considerable. Another big thing that happened during this pandemic was the screening of passengers at borders or closing air or rail hubs. And they say that experience has shown that these actions are not effective and could have serious adverse consequences and are therefore not recommended. So that's just a very, very small summary of all the stuff they actually wrote. And I'll link to the paper in the show notes. But let me go ahead and close with their conclusion. And they say, experience has shown that communities faced with epidemics or other adverse events respond best and with the least anxiety when the normal functioning of the community is least disrupted. Clearly not what we saw in 2020 or coming into 2021. Strong political and public health leadership to provide reassurance and to ensure that needed medical care services are provided are critical elements. If either is seen to be less than optimal, a manageable epidemic could move toward catastrophe. That's from Donald A. Henderson, who is pointed to as being responsible for eliminating smallpox off the face of the earth. And as you can see from his words, there's a lot of reasons why we shouldn't have done a lot of the things that were done in 2020. Anyway, that's something for you to think about. Again, I'll link to the paper. It's well worth the read. And I'll see you next time on the show.